Good day and welcome to another HIMSS TV digital checkup. I'm Bill Sawicki, features editor of Healthcare IT News, a HIMSS media publication. Today we'll be digging into patient portals, which have increased in importance and popularity during the COVID-19 pandemic. My guest is Chris Wickersham, Director of Customer Support at CereCore, a health IT consulting firm. So let's jump into my questions for you today, Chris. My first question, how does patient portal support play into a more modern infrastructure model for healthcare provider organizations?
Okay, yep. So the patient portal experience really helps put the power of patient care into the hands of the patient. It really allows for ease of access with reaching doctors, providers, clinicians with any help that they may need, whether that be a request for a prescription refill, or they're requesting an appointment with a provider, just some basic technical advice or clinical advice that they may need. Especially with modern healthcare, as we've seen with the COVID pandemic, telehealth has really been booming, and most telehealth visits are actually initiated through that patient portal too. So I think we're going to see an expanded use of that, especially with this boom of telehealth here.
That's great. And now my second question, what were the biggest takeaways you saw at CereCore during the height of COVID-19 this past year with regard to patient portals? For example, key challenges, pain points, enhancements, etc.
Yeah, just kind of going off the last question, I think the boom in telehealth has been the biggest thing, the biggest takeaway that we've seen, and how we really need to streamline and improve that process, both for the patient and the provider experience. You know, the usage of telehealth, at least in the customers that we provide support to, exploded more than 500, 600% since the beginning of the COVID pandemic. Additionally, it wasn't just telehealth, but there was a new level of anxiety for everybody with this COVID pandemic. The hospital phone lines were off the hook. People were getting tested and waiting 5, 6, 7, sometimes 2 weeks for lab days, or sometimes 2 weeks for lab results. So just having that quick capability to access their patient portal to see, what's outstanding, what's out there, get meaningful results, message providers quickly and efficiently. That was a huge piece of that. So one of the challenges that we really ran into was just increasing our overall level of support. It was being able to walk patients, whether they were younger, older, and kind of bridge the technological gap that some patients may have, to being able to log into their portal, view their information, understand how to read that information, and really connect back with their clinicians. I think one of the biggest challenges that we had was just understanding all of the workflows that go into launching a lot of these telehealth visits. Many hospitals ramped up that telehealth usage quickly and fast because there was a need to do it. Sometimes 3-4 year projects were condensed down into 3 to 4 months. And the last thing that comes to mind when you're going forward with these projects is how to support them. So it was, really an overall team effort through all of the organizations that we've worked with, along with our internal staff, to really build strong support matrices and processes so that we can step patients through, these workflows to really get them connected with that clinician or physician on the other side as quickly as possible.
Question number 3, why is patient support so crucial to a successful patient experience, especially as we prepare for a second wave this fall with the Delta variant, return to school, etc.?
Yeah, I think it's so important. I mean, it's just putting the power of the patient information in the patient's hands. At the end of the day, I think that's all we can do as healthcare organizations, is give patients as much accessibility into their own health as possible. When you're looking at the ability to see what a past appointment was, where a lab result was at, a note from a physician. I think being able to do that as quickly and as efficiently as possible, especially in today's digital world, where anybody can pick up their phone and look at a recipe, they can look at directions to their nearest pharmacy. But why can't you do that with healthcare too? So I think one aspect of patient support is getting the patient logged in and actually signed up to the portal, which is one of the major requirements of meaningful use. I think the next step that we really have to look at, though, is not just login and acceptance rates, it's retention rates. Are those patients going back into the portal? Are they utilizing it regularly? It really helps by having an efficient patient experience for so many different workflows. It really helps drive down overall healthcare costs as well too. And let's take a look at just the prescription refill workflow within a patient portal. 5-10 years ago, you had to call the office. You had to request to speak to the physician or talk to the nurse and let them know exactly what prescription you wanted refilled. At that point, that nurse, that front desk scheduler, administrator, or office admin would work with the physician, have them re-trigger that prescription, maybe call the pharmacy, make sure that it was ready. In today's world, an analyst goes into their cell phone. The patient goes into their cell phone, they log into MyChart, they log into the patient portal, they click on the prescription, request that refill. It gets directly sent to the physician who wrote that prescription. They approve it, and it automatically gets triggered to that pharmacy on file. So if we're looking at ways to find efficiencies in the overall healthcare paradigm, I think putting as much power in the hands of patients as possible is really going to be key.
And finally, my last question for you today, Chris. Where is the future of patient portals headed?
I think it's going to be that's a great question, and it's going to be exciting to see where these next 3 to 5 years go. And I'd really like to tackle that in 2 different parts. When it comes to the future of patient portals, focusing on telehealth, I think we're going to see the introduction of new peripherals into the patient experience, whether it be, rather than just being the camera on your computer or the camera on your mobile device to initiate telehealth. I think you're going to be looking at different devices that help provide clinical readings to providers that get put in the patient homes. And when they're doing that, they're able to interface directly over to the provider to provide almost an in-person experience for that provider that they might not get in today's telehealth through a video chat that we see. So I think, that reintroduction into the different devices that are going to help providers is one key aspect. But I think you're also going to see the integration of third-party applications into the patient portal experience as well too. What's to say, everybody carries an Apple Watch, a Fitbit, their phone. It's keeping either their Apple Health or their Android Health, where it's telling them how many steps they're taking a day, how active they are, how much sleep they're getting. That, who's not to say that can't integrate directly into the patient chart that gives providers more of a socioeconomical understanding of what patients are going through, so that they can not just read, the metrics that we've seen day over day in today's healthcare, blood pressure, glucose levels, those types of things, but looking at the other things that go into overall health of a person and really help provide more prescriptive healthcare in the manner of preventative medication and lifestyle changes that will lead to an overall healthier United States.
Thank you very much, Chris. And that ends today's HIMSS TV Digital Checkup. HIMSS TV viewers, stay tuned. Another digital checkup is coming soon.